A t-shirt on, it's going to be a little bit easier to see. We're going to start with the iliac crest, go to the posterior superior iliac spine. So, the very top of the ilium is your iliac crest. Okay. As you follow the iliac crest down, you'll find the PSIS, posterior superior iliac spine. That's like the dimples in the back, right? So iliac crest, that would just iliac crest right here, palpate all the way around to the back to the posterior superior iliac spine. If you go all the way over here, obviously that's way too far. Okay, but it does come to right about there. That's right where the dimples are in the back. Spinous processes. Okay, spinous processes are here. And the way that we can do spinous processes here too is we're going to start with our hands on the iliac crest, come over to the center with your thumbs. So right there, level 4 to 5 is right there. Okay, so if we go just below that, that'd be 5, 4, 3, 2, 1. And then down there, back at level 5, you go just below level 5, that's going to be the spine of the sacrum. Iliac crest all the way over, that's level 4 to 5. Go just below, that's 5. Up, 4, 3, 2, 1. Below level 5, spine of the sacrum. Good questions? Everybody's got that? Transverse processes are on the side. Paraspinal muscles are on the side. Supraspinous and interspinous ligaments. Remember, supraspinous runs the length of the spinous processes. Interspinous ligaments are in between each of the spinous processes. You can't really palpate the interspinous, but you have to tell me where they are. So they're in between each of the spinous processes right there. Supraspinous lies right on top of the spinous processes. Okay, everybody following me? We good? Okay. Paraspinals, we got latissimus dorsi. So latissimus dorsi is this muscle right here. Palpate it here, and then tell me that the tendons go up into the shoulder. Because lats do shoulder extension. Okay, so major part of the muscle is here. The tendon extends up into the shoulder area. Abdominal muscles, when we do the abdominal muscle, have them lie supine. When they lie supine, have them come up into a quarter of a sit-up, just barely, okay? And then palpate the musculature. Got it? Okay. Questions on palpations? Everybody good? Okay. Going on to the neurological testing. We're going to have to sit on the table. Yeah. Do you want me to take you back? Is it easier if I go to the back table?
This is bigger. Do you feel
Here, I'm
Let's go right here.
This no. All right, taking the show on the road.
Oh, turn around now.
Adam.
Hello.
Hello. Hello.
Hello.
Good.
Okay. Okay.
Okay, so remember, when we do neurological testing, the nerves have 3 different properties, right? They have strength, they have reflex, and they have sensation. So those are the 3 things we have to hit on. Levels 1, 2, and 3, they're all going to be the same thing. So our strength comes from the iliopsoas. What does the iliopsoas do? Hip flexion. So we're going to test strength by having Alexis lift up the leg, hit your hand, don't let me push you down. Okay, that is testing hip flexion. When I had my back issues and I had a disc herniation, they would do this to me and they could push my leg right down. Didn't stay up at all. Okay, so that's a good indicator of something that's going on there. There's no reflex there. Anterior thigh, so just the front of the thigh down to the knee. That's your sensation. Got it? Moving on to L4, tibialis anterior. So what does the tibialis anterior do? And inversion. So have the patient dorsiflex, bring the leg up, stabilize the lower leg, go into inversion. Do not let me pull you out. Okay. So again, they do this test and they are easy to pull out of that. They're going to have some nerve damage, or not damage necessarily, but it's going to be pushing on them. Okay, relax. All right, patellar reflex. You can get your reflex hammer and you can hit right there. You can see that jump a little bit. So that's easy to do. And medial lower leg, right in here is our sensation. All right. Questions? We're good. L5, extensor hallucis longus. Anytime you have hallucis, that means the big toe. Can I take that off? Okay. We're going to take that off. So, stabilize again. We're going to stabilize. I can actually stabilize the foot instead. Take the toe up, because she'll dorsiflex at the same time. We don't need to do dorsiflexion. We just need to do the toe. Have the toe into flexion, or extension, I mean, and then pull against the toe. Good? All right. No reflex on that one. Top of the foot to the lateral lower leg. So right here to here is your sensation. Good? Questions? S1, peroneus longus. So, peroneus longus muscles, these guys are your lateral muscles over here. What do? Plantar flexion and eversion. So the exact opposite of what we had before. So plantar flex, evert, take it to the outside. Don't let me pull you out of that position. Okay, our reflex is the Achilles. So make sure that they're relaxed. You can take the reflex hammer and just hit back here. You can see the toe jump a little bit. Okay. And then our sensation is lateral malleolus to the small toe. Start right there. Tell me the sensation goes from here to here. You can tell me what it is. You can say sensation is lateral malleolus. You need to show me too. Because if you tell me lateral malleolus and you do it the medial side, you're wrong. Okay? So you have to not only tell me, but you have to show me at the same time. Because this is the easy stuff. You guys know medial lateral. But if you screw it up, sorry, you're out of luck. Last one we're not going to do, but you are going to explain it to me. You would have the patient supine. You're going to have the end of the reflex hammer. You're going to expose the abdomen. You're going to think of it being in 4 quadrants. And you're going to drag the tip of the patella or the tip of the reflex hammer across the abdomen in one of those quadrants. You should actually see a little tiny bit of movement of the umbilicus towards that side. It is fun. You can try it if you want to, but again, you're going to explain it to me. You're not going to do it. It could be a little uncomfortable in here, so we're not going to do it. However, you do need to tell me what it says here at the bottom, right? If you're doing the upper quadrants, either left or right, you have to tell me it's T7 to T1. That is the spinal level that we're looking at. Okay. If we go to the lower quadrants, we're looking at T10 to L1. Okay. Or, oh yeah, what did I say? Oh, T7, sorry. That would be all. All right, T7 to T10 for upper, T10 to L1. Special test. Everybody remembers Babinski, correct? Babinski. Drag your thumb across. Oppenheim, all we're going to do is take the reflex hammer again, use the metal side of the reflex hammer. We're going to irritate the medial tibia like this. And if we see toes extend, okay, it should, or if it extends, it should curl. If it extends, or it should do nothing. If it actually extends, then there is some sort of brain damage going on. Okay, so it's just another way to test that besides Babinski. All right, if you want, well, not if you want, I need you to lay back on me.
Have to like shoot.
Was that you want your shoe on?
Wow, Alex.
Okay. Good. All right, stretch the leg raise with forced dorsiflexion. So I'm going to take this up. Relax. 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 I'm going to stop. Good. Then we're going to, at this point, when the patient tells me to stop, we're going to force dorsiflexion. She has a lot of pain through the hamstring and into the calf. That's a positive sign. So take it up until the patient says stop. Force dorsiflexion. Pain elicited in the hamstring into the gastroc is a positive test. Hoover, I think, is next, and it is. Right. So what did we say was cool about the Hoover test?
It says if they're lying.
Yes,
Why
test
are
if
you
you're lying.
Why?
So if this is the injured side, okay, I'm going to put my hand under the non-injured side. I'm going to have them do a straight leg raise, so go ahead and try to hit my hand. Okay. I should feel a little bit of pressure under here, but not much. Okay, if they're fine. If they are fine, I have a little bit of pressure when they do that. If they are truly injured, I'm gonna feel a lot of pressure on this side because she's gonna have to use accessory muscles to get that leg up because she's in a lot of pain.
I know all about that.
Got it? It's confusing to understand the concept, but I think it's not that bad.
I think Seth understands.
Got it? So a lot of pressure under this leg. She's using accessory muscles. It's not working for her, and she does have a lot of pain. Good? All right. Then we have the well straight leg raise. So now what we're going to do is we're going to have you straight leg on the good side. And if she has pain on this side in the low back, it's a positive test. So we've got a couple different straight leg raises you have to know the difference between. Questions? Okay. Kernick. Okay, so this time I want you to take your hands behind your head, bring your head up a little bit. I want you with your straight leg, okay, keep it straight, don't bend it. Go up as far as you can because this is active. Remember, I'm not doing this. So take this up as far as you can. Now, that's really good. At some point, if she's injured, she's going to have pain. So say she has pain right here and she can't go any further. I will tell her to bend her knee. That should relieve the pain. All right? That's Kernick. And obviously, if it relieves the pain, it's a positive test. Good? Because that one might have been confusing. Valsalva, we know. Anybody have questions on Valsalva? No? Good. Sacroiliac compression and distraction. On your test, it says it's worth a point. I made it worth 2 points because it's two different tests. So, if we are to compress, we're compressing the joints in the posterior aspect. How do we do that? Okay, we're going to cross hands like this, right? We're going to push out, and that compresses sacroiliac in the back. If we're going to distract, we're going to come here and we're going to push inward, right? So we're pushing inward. That distracts sacroiliac joint in the back. So make sure you know which is compression, which is distraction. Next one for sacroiliac. Go ahead and cross your heel over your heel. There we go. We're going to do this, and we're going to take this, and we're going to push this down. This is your Patrick test. Again, what do you think's happening with the ilium? You're compressing. You're pushing it into the sacrum. So that would be positive if they elicit pain on that one. Relax. Milgram is the last test for herniated disc. Most of these are for disc or sciatica. All I need you to do is make sure that your back is flat against the table. You can. Good. So you kind of have to do a little bit of a pelvic tilt. Good. And then lift your feet just 2 inches off the ground, both, and relax. Because you do that normally, that is not good for your back. We don't like to see that. Okay. The 2 inches that coaches do, probably not the best thing for your back. So I asked her to go into a pelvic tilt. You guys know what pelvic tilt means? Okay. You don't know how to do that. Put your hand under the middle of their back, the low of their back, like that arch. Go ahead and press my hand. Good. See, when you give them something to visualize, it works a little bit better, and then have them lift. That's going to protect the back a little bit more. But if we do that, if we protect the spine, we do 2 inches, and she's still in a lot of pain, that's a positive test. Okay. So go ahead and stand up for me. Okay, thanks. Flexion and extension, we're not going to do active and resistive on this, so all I'm going to have to do is I'm testing the hamstrings, the tight of the hamstrings. So go ahead and touch your toes if you can. And then extension is just the return motion. I'm not going to take her into hyperextension. We're just going to do that. Our lateral bending and our rotation, we want to make sure that we have stabilized the hips. Okay. So if I ask you to lateral bend to the left, okay, I'm going to stabilize still on the right side, and I'm going to say, don't let me push you out. Good. Relax. Go to the other side. Stabilize. Don't let me push you out. Now, when we rotate, go ahead and rotate. Stabilize the hips. Relax. Don't let me pull you out. Okay. Switch sides. Okay. Don't let me pull you out. Got it? That's pretty easy, yes? So don't forget to stabilize the hips when you do this, because that's points off automatically. And then the rest. Right? I mean, you know the rest. It's just a progression.
Walk,
It has to be in order.
jog,